Hi there, welcome to a presentation by CBH Education in our pharmacy revision series. Today's topic is salbutamol. Now, salbutamol is something that we tend to see all the time when you're dispensing prescriptions, when you're issuing prescriptions, even when you're doing your asthma reviews. It's one of the most commonly used inhalers that we tend to find in both pediatrics and adult. The context of this lecture will just mainly focus on general use in adults for salbutamol. So the indications are for the relief of acute asthma symptoms, including bronchospasm, and obviously to prevent allergen or exercise-induced symptoms. Now, the mechanism of action that it acts on the beta-2 receptors to relax the smooth muscles of the airways. Side effects can include arrhythmias, headache. Key side effects: hypokalemia with high doses, muscle spasms, nasopharyngitis, nausea, palpitations, rash, and tremor. One of your key drug interactions is the risk of digoxin toxicity. And in our earlier presentation, we have covered digoxin, and digoxin is a drug that undergoes therapeutic drug monitoring and very important to monitor the digoxin plasma serum concentrations. And in severe asthma, the potassium concentration should be monitored. Now, with salbutamol, you have to make sure that obviously patients are not using it as the main medication. So when patients are diagnosed with asthma, we've got different types of asthma. You've got seasonal asthma, exercise-induced asthma, asthma that can be predisposed to an allergy, and patients who have actual asthma symptoms, and they would be controlled on an inhaled corticosteroid, which is known as their preventer. There's a common misconception that the blue inhaler is actually the reliever. So some of the key phrases that will help you with your revision and the things you may come across in clinical practice is the aspect that I've mentioned, the reliever. Patients need to be counseled on the blue inhaler and how to use it as well. Most patients that you tend to meet or you tend to see in practice, they will order the inhaler maybe 1-3 times a year as per NICE guidance. Now, you've got the use of beta blockers. It's better to use cardioselective beta blockers, and this is usually initiated by a specialist. Now, we've talked about the reliance on long-term control. Patients need to be counselled that they shouldn't be using this regularly, the 2 puffs 4 times a day. It should be used as and when required, and obviously if they do have an exacerbation, then they can use it as well. And if they're over-ordering, this can indicate an issue with asthma control. So this is where you come across in your audits, when you're dispensing in community pharmacy as well, and also looking at the type of asthma as well. Now, one of the key things is looking at the patient's technique. Are they able to use their inhaler properly? Are they able to use it in conjunction with the technique that's recommended, or do they need a spacer device? Or if it's more complex, do they need like an easy breathe preparation that needs to be changed over as well? Some of the key things to reinforce the patients is, number one, the message of using the inhaler. Make sure that they use it as their reliever and not their preventer. If they are having problems using it and coordination, consider the use of a spacer device. And obviously, if the the use with a spacer device is poor, then consider changing the preparation as well. Another key thing that you tend to come out with as well is that patients sometimes will just have this as a one-off, maybe for a viral induced wheeze, if they're a pediatric patient, or if they have exercise induced asthma, they may have it on their repeat prescription, and they may order it as and when they need it. Thank you very much for listening to this presentation by CBH Education. Please follow us on our social media platforms, Facebook, Instagram, and YouTube for more presentations in our pharmacy revision series covering drugs, covering lectures on pharmacology, covering the legal aspects of prescribing, and also over-the-counter conditions and medications as well.